web platform. We are all kind of live as I make you live. You can see from the list on the left, the folks with the phone icon are live. Chris, I'm not sure if you have audio access. I tried to make you live. And then just wanted to point out Ken and Meg, if you want to speak on audio, Ken, I know you've used Webinato with us before. We have an easier time hearing people and getting access to everyone's audio if you use the phone audio instead, so you call in on the line. If you're not sure how to do that, at the bottom of the webinar window in your browser, there on the left-hand side, there's a phone icon and there's a computer icon. You can actually switch to your phone audio, and I can make you live that way. So just wanted to point that out. And otherwise, I know we have at least 4 folks on that I heard, which is great, so we can get kick-started with those individuals. And I think we were expecting about 11, so 9 is a good place to be. So again, just wanted to mention that we are talking today about engaging collaborators in the community. This was actually a topic area that was brought up by a couple of folks in Virginia, and I don't believe Kristen, who I initially spoke with about this, was able to join us, but hopefully we have someone, Beth or Mackenzie, are able to join us at some point today. So for our overview for our agenda, I sent some of the guiding questions as well as the basic agenda, which is just that we will overview the community of practice, just review the quick guidelines of participating in a community of practice, open the discussion around successes and challenges encountered in engaging partners, collaborators, and stakeholders from target communities in your 1509 projects, and then discuss next steps and available resources. Great. So I just wanted to quickly review the ground rules and just to mention them as some guiding principles for moving forward in our discussion today. Make sure we're focusing our conversation on creating better results in our communities, supporting each other's efforts, actively participating if you choose to, engaging in non-invasive, non-judgmental discussions, respectful disagreement. We are on a web platform, and most of us are on the call line, so be sure to try your best to allow others to finish their thoughts and contributions before weighing in. You can also use the chat box on the bottom left if you're having trouble accessing audio. And also just wanted to reiterate something that we've mentioned in the past, which is maintaining confidentiality within the COP participants. So unless someone offers to a resource or a lesson learned or a key finding to the group to bring outside of the group beyond our community of practice, 1509 community of practice, please refrain from sharing that information and consider it confidential unless your peer allows you to share it more broadly. So again, I believe I have a couple more folks that got on the line, and if you're having any trouble with audio and you'd like to access audio, please send a chat in the chat box, and I'll do my best to get you live. So I wanted to open up the discussion. We have, as I mentioned, had a previous discussion with some folks in Virginia, and I don't see anyone on right now, but what had come up in that discussion related to engaging collaborators was around this challenge of, one, developing new partnerships in the community, with new non-traditional partners, and having some challenges with engaging those groups, and then also having challenges engaging the target population, and specifically the non-working target population in their 1509 project. And so I thought it would be a great opportunity to bring it to the larger group have it recorded and minutes available to individuals that aren't able to participate, but allow for the 1509 constituents to really be able to share what your experiences have been, what your successes have been, and bounce some ideas off one another. So I just want to open it up to the group. I believe we have at least Evelyn, I heard, Julie, Kate, hopefully you are live. Lena is there. Oh, Bruce and Beth from Virginia. Great. Okay, sorry, Bruce. I didn't recognize your name from the registration, so I apologize. So we do have some folks from Virginia on the line. Donna, I made you live, and so I think there's only a couple people that might not be live, but hopefully you all can kind of engage in that. So Bruce, I don't know if you wanted to start the conversation. I know it was your colleague, Kristen, that originally brought this up to us, but any kind of successes or challenges that you've been having, and we can kind of go from there and get some feedback from colleagues if that works.
So with our collaborative, we're using the Planning Council for the Norfolk TGA, and the group was originally small, and it has been expanding, but I think the quest to get more players in on the collaborative effort was the reason Kristen originally reached out to you.
Great. So I guess so maybe there's a question for the larger group. I know Virginia had begun with their planning group as kind of the foundation to building partnerships and engaging external collaborators. Where have other organizations or other jurisdictions started, and what have your successes been in kind of engaging non-traditional partners and individuals in the target population so far?
Hello, this is Evelyn from Philadelphia.
Hi, Evelyn.
How's everybody? So just a little, so I will say more of us wanted to be on the call, but we just are in the middle. It's the first day of our 1509 site visit. So my colleagues now are accompanying the CDC staff to two of our provider sites. So I'm kind of representing Philadelphia on this call. But what we did here in Philadelphia is aside from getting 1509, we also get CDC money, state prevention monies, and local monies to do HIV testing, as well as we get Ryan White money. So we get multiple sources, and we're sort of leveraging those systems. So we put out a bid for navigation teams and navigation agencies, and those navigation agencies already have existing programs, HIV testing programs, that have shown a demonstrated impact in being able to reach gay or bisexual men of color. And so that's how that recruitment's happening through those testing programs. So our testers are doing initial eligibility and recruiting people into our 1509 funded navigation services.
Great, that's a great example, and I just wanted to, I think Baltimore actually also is having a site visit today, and so I know they were having trouble participating as well. So good luck on your site visit, and thank you for kind of sharing.
They're kind of hitting the Northeast in the next week or 2 weeks.
Great, so busy for everyone. So I guess that's a Philadelphia example. Anyone else kind of want to weigh in on what they've been doing in engaging folks?
This is Donovan Jones from New York City. So we actually have an HIV testing initiative called Brooklyn Knows that was launched in 2010, I believe, and that has about 97 initiative partners in it. These partners range anywhere from CBOs to community health centers and hospitals to faith-based institutions and some small businesses. So we use that as our kind of building planning group to get things, I don't want to call it planning group, but our group to get things started. And we've actually been working the other way. We've been kind of within that larger community looking a little bit closer at who's actually providing the most services to MSM of color. And that's anywhere from clinical services to also other services related. So our capacity assessment was actually taking the larger group and actually figuring out who in that larger group that already works together is our core group for the planning of our 1509 activities.
That's great. And are you, sorry, go ahead.
Sorry, and in addition to that, similar to what Philadelphia said, we've also, we're bidding out some contracts currently with testing agencies and non-testing agencies who have a proven record of working with the priority populations. So from that angle, we're making sure that we're working with agencies that have experience in reaching and providing services to Black and Hispanic MSM, transgender women of color. That's it. Thank you.
Great. And I actually have a follow-up question for you, Lena. I was just curious, what are kind of your metrics as you guys are looking at these 97 partners for determining kind of who provides the most services to MSM of color and who has a proven record of working with the population? Is it based on contracting that you've done with them, or how are you kind of sorting through that information?
Sure.
I'll actually turn that over to Robert Jones, who works with the New York NOS team, the testing initiative team, to answer that question.
So this is Rob. I'm the Brooklyn liaison with our Brooklyn NOS collaborative, and we've conducted a number of capacity assessments mainly with clinics and a few CBOs here in Brooklyn as well. And through the capacity assessments, we really touched on who are your target populations, what kind of services that you are offering, what type of HIV testing and other services, navigation services are you offering, and where. And through that really gave us a good picture of really who was working with our target populations and what challenges they were also facing. We also talked about PEP and PrEP services in addition to HIV testing and data reporting and collection as well.
So there were obvious questions we were asking, like what percentage of your clientele would you consider MSM of color? But then there were more indirect questions we asked, like do you provide STD testing in extragenital sites? Do you, things that would actually, do you perform a sexual history that includes the gender of your partner? So stuff that directly asks about their services and who they provide services to and also how they provide those services.
Great, thank you. That's really helpful. That's That's a great way to kind of look at that and sort through existing partnerships. I know. So we heard kind of from Virginia briefly and Philly. I think we have Julie from, I don't want to put you on the spot, from Louisiana on the phone. I don't know if you wanted to share kind of how you've, as your collaborative or your project has moved forward in engaging outside collaborators and individuals representing the target population.
Yeah, hi, this is Julie. I have several of my coworkers in the prevention unit here with me. We have been putting together our collaborative. It consists of 4 main community-based organizations that we had existing relationships with, and they do have a history of reaching gay and bi men of color. And we are bringing on lots of new partnerships, folding them into the collaborative. And they represent just a wide variety of different social services. We actually had our first meeting of the entire collaborative just last week during our 1509 site visit, which was Thursday and Friday. So some of those new partners include folks that work, in substance abuse, in job training, and just a variety of different social services, so we can kind of provide that holistic wraparound approach. And then in terms of successes in engaging gay and bi men of color, we've really been working on hiring peer navigators that are going to be embedded in each of those 4 main prevention CBOs that I mentioned earlier. So that's been the focus. And I think at this point, like very recently, they've all been hired, and so now we can start actively doing more peer navigation and connecting to all the different types of social services that represented in the collaborative.
Great, thank you. Awesome. And so I know Kate was trying to get Ken from DC online. Kate, I don't know if this is something you feel comfortable weighing in on, what you guys have been doing in DC, but I don't think Ken got live on audio unless I'm missing that.
Well, go ahead.
Can you hear us? This is DC.
Yeah, I do hear it.
Great. Then I'll let, we just went into a room together, so I'll let Ken take it.
Oh, okay, great. Hi, Ken.
The old-fashioned we just used the old-fashioned cell phone. We went back, so we just got in the conference room. But update you. Wow. We have, I guess, a lot going on. I'm going to, and Kate can fill in. So a lot of great things have happened. I'll just be all over the place. One of the things that's happening in terms of, I've heard folks talk about the navigation arm of this. Actually, this week we started training for what we hired 13 individuals from who had been recommended from various community-based organizations. So this week they're actually training with us and going over a array of topics and conversations so that they can go back out into various community-based organizations. The way that we've done it is they may have been recommended by one organization, but we're actually sending them someplace different. So they'll get to experience different populations and ways different community-based organizations do. So we have 13 folks on board, and we really tried to make sure that they represent the community in terms of our Latino population, in terms of our trans population. So we have a very diverse group of folks, and their training with us will go on for a week, and then we'll deploy them into various CBOs. And so that's what's happening with that arm. Another exciting piece is this week we will announce 13 organizations that will be getting funding for specific projects around PrEP, community wellness, which is a couple of different models around behavioral health, and that announcement will go out tomorrow or within the next few days. Again, a lot is happening this week. We have our full coalition meeting. There are 80 folks on the list representing, I would say, roughly around 30 to 40 organizations. And we really tried to think of one of the things we've been strategic about is the small fish. As the small organizations, we really do have some level of access, but may not have the infrastructure now. How do we bring them on? How do we pair them with other organizations? So we really got a combination of some of the usual suspects who do really great work. So how do we bring more organizations on? So we've really been looking at some of the smaller organizations as well. Also, we've done some site visits to places in our Maryland partners, PG County, as well as Virginia. So we have our health departments, our local county health departments on board in terms of helping us identify other organizations in Virginia and Maryland to expand our network. So that's pretty much where we are, Kate.
I think you hit it all.
The exciting thing, we talked about this in the meeting the other day, is one of the things we did with our proposal, we actually sort of flipped the way that we engaged in the RFA process. We made the process more about the site visit, and the site visit was really based on what our work groups believe was a way to really get a sense of an organization. We spent a lot of time talking about things in terms of cultural competency. So we had folks from different regions go out and do the site visit, so they really went in blind to get a sense of what the organization was like, and that what we used as a mechanism was designed by the collaboration itself. So we had a really interesting process in terms of a different RFA process where it was really based on the site visit.
That's great. And I think, Ken, I know maybe Lena has heard this before, but is that your kind of mystery shopping technique that you were doing?
No, that's coming later, but the mystery business, for example, who took someone from our Virginia Department of Health who had no real relationship or understanding of an organization in D.C., and we asked them to do the site visit. That way people went in, you really had to paint the picture yourself. Historically, we all know that folks can write a really great RSA, but, we really wanted to get a sense of what people were doing, so we asked people from different regions to actually conduct those site visits so the organizations would have to really be able to demonstrate, or at least as best they could in that site visit, areas around being able to access the population, cultural competency, data collection, and those sort of things.
Great. And I had one other question. The 13 individuals, going back to the navigation piece, Ken, the 13 individuals that you are training, I guess, to go back to the CBOs, they're recommended as having been consumers or clients at those CBOs, or having been employed by those CBOs?
It was a combination of all of those. We looked at it from different angles. We looked at it in terms of workforce development. We looked at it in terms of who could be peer educators, who could do some of the navigation. So we went across all that you just said and see how do we bring that into a team of folks we thought could really be, one, we wanted to make sure that the individuals could benefit from it, and two, also how could they really engage with the different community-based organizations. Most of them, if they had worked at organizations before, it may have been like a part-time, similar type situation where they had done some peer navigation before.
Okay, great. Great. So I think it's great to hear all the really important work that all the organizations are doing. I also kind of wanted to open up the discussion for folks to discuss any sort of roadblocks or challenges that they've encountered, whether big or small, and as they're kind of engaging in these new partnerships, whether they were part of the initial collaboration on applying for 1509 or being engaged afterwards, engaging new partnerships that represent the target population, et cetera. Just wanted to open it up to everyone. What have been your some of your challenges, and where, what lessons learned or key findings have you had so far in the process?
This is Donovan from New York. The biggest challenge for us has actually been due to the fact that our RFP has made it so we can't really talk to our collaborative partners too much about our activities thus far. So everyone in the Brooklyn Knows Initiative knew about our application 1509. They all signed on. They wrote a letter of support. They're very excited to be part of it. And then once we were funded, we couldn't talk to them about it because we knew that there was a pending RFP that's technically still pending. They're applying as we speak. Our conversations with them have been very superficial, and I think our real planning with them, we'll dive into it as soon as people have actually applied, and we don't have to worry about that anymore. So that's been huge for us.
And that's also because we envision our collaborative in two tiers. We have the core collaborative of funded agencies, whether it's funded through 1509 or other health department contracts, and then that larger Brooklyn Knows or New York Knows collaborative. And so, once we're able to establish, once the inner core of agencies submit their applications on Thursday, then we can start discussions with that outer tier that's really, we're leveraging their experience and their support in really fleshing out all these services and operationalizing the collaborative.
Great. And Lena, just kind of thinking of maybe a similarity in what you're doing as to what's going on in DC. I don't know if I thought it was interesting. Ken was talking about kind of making sure that the small players are still have their neck in the game and are engaged and maybe supported by some of the larger agencies. Is that something you're envisioning as, with the tier 1 and tier 2 type collaborators?
So one thing we've done with our RFP is making sure that it's those CBOs that are non-clinical, so often be smaller agencies, and those that maybe don't have the capacity right now for lab-based, fourth-gen testing as well as fourth-gen testing in general. So that's one way that we've really we've put preference in the RFP solicitation for the smaller organizations and maybe less established organizations.
Is that kind of what you were getting at?
Yeah, no, that's great. I just was I was interested in where I'm interested in kind of the tiering and was envisioning it to be somewhat similar to what DC had mentioned. So that's great, and still engaging kind of the smaller CBOs, which is important. Anyone else want to share some of their challenges that they've had in forming these partnerships? And I can also, I'll open it up a little bit more. As I mentioned kind of in the beginning of this discussion, one of the kind of conversation starters that came up was engaging and interacting and engaging the individuals in the target population that are non-working individuals, which is part of the reason why I was asking Ken about the training of the 13 individuals that they're working with in CBOs. So I'm curious if any of the other jurisdictions, kind of beyond our initial conversations with some folks, have had these similar challenges in engaging individuals in the target population, and if not, where have you really had success, and where can you kind of share some lessons learned that you've had with some of the other jurisdictions that are having some challenges in this particular aspect? And Evelyn, you should have access to audio now.
Okay, thank you.
Oh, there you go. Great. Did you want to weigh in on any of the discussion questions?
I was just going to say, in terms of challenge, you know, we had a core collaborative group, and now the challenge for us is to go beyond those traditional agencies that we have funded and look outside for collaborative members who do, you know, employment training, for instance, or job readiness, or behavioral health outside, you know, traditional systems that we have funded. And so the challenge there, and we have made some inroads, is, you know, what can we offer them, because we're not going to fund them per se. And so our tact has been that we can offer clients, but also, you know, with that is you have to make sure these agencies that don't primarily work with MSMs, because, you know, they serve everybody who needs job training or or health literacy or something like that, are culturally competent to serve our clients. So that's, you know, kind of been a challenge that we're looking at.
Great. I think that's important. I'm curious, what have, you know, some of the other jurisdictions used as an incentive, again, beyond, as Evelyn mentioned, beyond new clients possibly, to engage some of their stakeholders or partners if you're not able to provide the funding to kind of back it up? Have there been other incentives used by any other jurisdictions? Okay. Well, I think that's an important piece to mention, Evelyn, so I'm glad you did, and hopefully we can kind of get back to that, and if anybody has any other thoughts, that would be great. I also think it was interesting and important to kind of touch on, and I've heard this on other calls, the engaging of the non-traditional partners, as you mentioned, so folks that you haven't worked with or funded before, and how you've reached out to them, and I'd be curious as to, outside of the typical HIV agencies, where folks have gone to engage additional collaborators that really impact the full kind of holistic scope of this program.
So this is Ken. I'll take a stab at what I think. In terms of what we have just tried to do is make the connection between folks who we know are doing work, and it's been relatively, I wouldn't say easy, but for example, relationships around folks who do housing versus people who do HIV, and I think in DC, some of those conversations are being had on different coalitions already. So it wasn't terribly difficult to bring folks together who don't usually sit at the table around HIV. It was just a matter of, I think, well, we didn't make it feel like it was a competitive process to be at the table. That yes, there could be dollars involved, but what is some of the impact in terms of what you're trying to achieve? And we've had some success about really sort of just asking folks what are your needs and what are you trying to accomplish, and then linking it to the work that we're trying to do. The enthusiasm around creating a system that everybody knows about, can access, has really been received fairly well. We're even talking to folks who wouldn't be at the table even around, particularly now with what's going on in the country around social justice. I had a conversation with someone yesterday. So it's just like, it's been fairly easy to sort of tap into what are your needs, and making the really small connection to say, we need to have you at the table. And it's worked fairly well in DC.
That's great. Thank you for sharing. And I'm not to put anyone on the spot, but I know Donna, I don't know if you have access to audio from Alabama. If you wanted to, I think we missed you kind of in the beginning when folks were sharing some of their successes and challenges, and I don't know if you wanted to weigh in on the topic and share what's going on in Alabama and where you all have been engaging kind of some of your collaborators.
Sure. Hello, everyone. In terms of Alabama, our project name is called Game Changers. And so I'm kind of fairly new with this project in the role that I'm in. However, the way the program was conceptualized was, again, pretty much the same approach that everyone else is utilizing. It's a collaborative approach. And with this Game Changer project, we have several collaborative community-based organizations that are participating. We have a substance abuse organization. We also have 2 clinics that are actually in the Jefferson County, Birmingham area that will be providing services to the gay population. And so part of our concept is to provide comprehensive health care, and through those efforts, each of the collaboratives that we have will be hiring 3 prevention specialists or navigators to provide the services in the Jefferson County area. So they'll be providing testing and education, outreach. Of course, their focus will be done, most of this will be done through the social marketing of the program. Some of the marketing has already taken place in the community, so the community is aware that the efforts are really available in terms of services. Our collaboratives have, which is interesting in listening to other states, is that many of the collaboratives have already been working together for years. And so I don't think, I'm on the outside looking in right now, but I don't see that there's been any challenges in terms of collaborating and providing services in that area. I'm trying to recruit collaboratives because these organizations have already been in concert on so many different levels already in terms of providing services in that area. This just allows them to focus on a particular demographic and provide services and do outreach in the area for MSM. So some of our successes thus far in terms of getting the program going is that we're still in our planning phase. And so we're working on developing our assessment tools. We're working on establishing protocols so that each of the collaboratives are providing the client service flow, not identical, but similar. And so that's been kind of, I guess, our biggest challenge, trying to make sure that we're all kind of doing the same thing and processing clients the same way, and just making sure that our protocols are agreeable to all collaboratives. I would say some of our challenges thus far that we're seeing in the planning phase is trying to determine how we're going to collect the data that CDC is requiring. Right now we have two options in the air in terms of looking at the better approach for collecting the data, and I'm not sure how other states are looking at trying to be compliant with what CDC is requiring. So that's going to be like our biggest challenge right now until we get into the implementation phase. But we're moving along. Our collaborative group, again, has an established history with working with one another in the Jefferson County area. So me, just coming into this project, I'm really amazed at the comprehensive services that are available in the Birmingham area. So, I mean, that's really pretty much all that I have to report.
Great, thank you. So a couple things that just kind of came to my mind, and I also want, please, anyone who has questions for anyone else, chime in, interrupt me, or type a message in the message box, and we can make sure you have some airtime. Just kind of had a couple other follow-up questions that I know have come up over the course of the last 40 minutes of this discussion. One is how to ensure the cultural competency of the providers that you're working with in your collaboratives. And I know Ken and the DC team mentioned what they're doing. I know some of the folks in New York mentioned how they're looking at a proven record of working with the population. I'm curious if anyone in Virginia or Louisiana, Alabama, Philly have any kind of other input that they would like to share on how they're kind of assessing the competency with this particular target population as they're engaging collaborators.
So this is Evelyn. So part of it is we're counting on Help HIV to do cultural competency training to our partners, and really looking at retraining people who we believe to be culturally competent and have a demonstrated effect in the community, but we're not taking anything for granted. And in particular, in Philadelphia, we're funding navigation teams, so we've already done some cultural competency training with them. Around their target, the target population, and we had a panel of folks come in to speak of their experiences in the social services and how what turned them off, what didn't turn them on, and so we're looking at not only for our new partners but really for our existing partners to look at that in a new way in terms of training and making sure people are culturally competent.
Hey, this is Julie in Louisiana. Since we were talking about cultural competency, I just thought I'd share that we're having success. This is also just in full disclosure supported by we're a 1506 grantee as well, and before that we were funded through CAPAS. So we've been doing this for a while, but we're continuing on offering Undoing Racism workshops. Both to all of our collaborative members, not just the 4 main CBOs that we're funding to do HIV and STD services, but also all the other non-funded collaborative partners as well. And that workshop is being provided by the People's Institute for Survival and Beyond, PISAB.org, if anybody wanted to check it out. But we think it's really important for people engaged in this work to be grounded in an analysis of institutionalized racism And we are also working with a local organization called Breakout that focuses on quality care for LGBT clients. And that organization does a lot of, it's really more of a social justice organization. They really fight the criminalization of queer youth of color in New Orleans. And so they kind of built a half-day training for us to offer to our partners. So that's sort of what we're doing on the cultural competency end of things.
Julie?
Yeah.
Yeah, I'm sorry. This is Evelyn from Philadelphia. I just want to say I heard about the group, the group you mentioned prior to talking about the group that does the I'm sorry, the kind of looking at racism.
Yeah, Undoing Racism. Mm-hmm.
Yes, Undoing, and I think they did something for NASTED in Washington D.C. It was like a 3-hour, and it's very well received. And we're actually looking at bringing them in to do some training in our system because I think it's also kind of nice to bring in people with an outside perspective. But I heard really good things about that group.
Oh, good. Yeah, you should definitely. I mean, I can't offer anything but praise for them. So, but yeah, I think it's a great idea. I think it really, a lot of folks, we make some assumptions about those of us who've been working in HIV or STD prevention for a long time that we have thought about racism in this way. And what we're learning as we offer this to more and more providers in our area is that many haven't. It's not really a part of any of our, college classes or a general education we get in our lives. And so it's been really transformative for people to gain this analysis and think about not just themselves individually, but as they're also just think about how their organizations and their organizational policies and programs unintentionally even contribute to institutionalized racism, and so I think it's awesome that y'all are reaching out to People's Institute.
Great. That's a great resource. I'm glad it's something that's being used across a couple of the programs, and we can put up some more information and a link to that website on Health HIV's website. And I also just wanted to address Evelyn's comment. I do know that the cultural competency modules for the toolkit are all being reviewed and finalized, and I believe the launch is probably within in the next the COP participants and 1509 individuals to access. It's not public, it won't be publicly accessible. But for your other colleagues that were not able to attend and may or may not be interested in some of the information shared, we will have a recording posted. We will have minutes as well. And if you have any other questions or comments, we can take them at this time. Otherwise, it was really fabulous hearing from everyone that was able to participate, and hopefully we will have kind of some additional findings and lessons learned to share down the road that we can continue this particular topic in the future. Okay, I don't hear anyone else chiming in, so we can sign off at this time. And again, thank you all for your participation and engaging in this conversation. And we'll send out some more information about our next community of practice topic that will be for the month of August within a week or so. So look out for that, and we look forward to hearing from you all on our next community of practice call. Thank you so much.
Goodbye, everyone.
Bye-bye.
Bye.